Good afternoon. I am Andrea Tóth-Mészáros, and the topic of my PhD project is investigating the efficacy and safety of adaptogens. I'm a pharmacist. I'm a first-year PhD student at the Center for Translational Medicine, and I also work as a pharmacovigilance associate for a pharmaceutical company. My vision is making the best of applying adaptogens in the evidence-based medicine, and my mission is to investigate the adaptogens' mechanism of action, their clinical efficacy, and to find out as many as possible in the right practice in their use. At the moment, we are working on two specific investigations. About them, I am going to talk in the next few minutes. The title of the first topic is Investigating the Effect of Adaptogens on Stress. Stress is omnipresent. It can manifest as fear, worry, inability to relax, difficulty in concentration, worsening of pre-existing health conditions, and also in an increased consumption of alcohol, tobacco, and different drugs. All in all, long-term stress can cause the substantial impairment of the human body's function. Regarding the prevalence of stress, many studies have been done, mainly on work-related stress, and the result of these studies seem to be between the 40% and the 50%. Acute stress normally increases the HPA axis activation and results in a temporary and functional cortisol level increase. However, long-term stress can result in a mild hypocortisolism or also in a continuously elevated cortisol level. So briefly, or simply put, chronic stress can cause the dysfunction of the stress system. However, the pharmaceutical treatment of the serious consequences of stress, like anxiety and depression, are more or less solved. There is no pharmaceutical treatment in the stress management. Adaptogens are expected and suspected to fill this gap. These are herbal medicinal substances, botanically and chemically diverse, and they are able to increase the organism's non-specific resistance to stress and decrease its sensitivity to the stressor. This is their stress protective function. They also have a stimulating function. Through this, they can prolong the resistance phase, and at the end of this, not exhaustion, but a higher level of equilibrium, the allostasis can be attained. The higher it is, the better is the organism's adaptation to stress, to its milieu, sorry. Our aim is to investigate the adaptogenic effect on the stress system. The clinical question is, do adaptogens have an effect on the cortisol level, cortisol pathway, and on stress? We are going to investigate healthy adults, and we are curious about two specific outcomes, cortisol level and the stress level, and stress level is measured by means of perceived stress scale. Cortisol in blood and also in saliva we are interested in. The hypothesis is that adaptogens normalize the cortisol level in stress, and the clinical implication is to provide pharmaceutical treatment in the stress management with rebalancing characteristics. Some data about our systematic search. It was conducted on the 23rd of November. We searched through five databases, and our final search key have two parts, two domains. In the first part, there are the names of the adaptogenic herb species, and in the second part, the different names of the different hormones of the cortisol pathway. We found more than 6,000 articles, and after duplicate removal, title abstract selection, full text selection, now we are working further with 24 articles. And the data extraction is actually almost ready. So the result is better than it depicted here. The title of the second topic is Investigating mucuna pruriens in Parkinson's treatment. Parkinson's disease is the second most common progressive neurodegenerative disease, with an estimated global prevalence of more than 8.5 million. It also means 5.8 million disability-adjusted life years, and both numbers have underwent twofold or almost twofold increase over the past 20-25 years. It's an incurable disease, so it cannot be. But the symptoms of it can be managed more or less with different pharmaceuticals. And the first choice treatment is levodopa. This is the precursor of dopamine. It offers a good control on the motor symptoms, but it also has its drawbacks, and it's not globally accessible. And here comes Mucuna pruriens in the picture. It's an adaptogenic herb, and it also contains levodopa. So it can be a good alternative for the levodopa, marketed levodopa treatment on the areas where it is not accessible. Because this plant spontaneously grows on tropical and subtropical areas of the world. As an adaptogenic herb, it has also been examined in the different Parkinsonian models for its neuroprotective function. And in two of the main pathogenetic characteristics of Parkinson's disease, it has already been found effective. There are also some randomized controlled trials with promising results. Those compare Mucuna pruriens treatment with levodopa treatment, so the non-inferiority of Mucuna pruriens to the first choice treatment. Our aim is to investigate Mucuna pruriens treatment in Parkinson's disease, keeping in mind that it's an adaptogen. The clinical question is Mucuna pruriens non-inferior to the first choice treatment in Parkinson's disease? And the outcome is the Unified Parkinson's Disease Rating Scale. It's the most commonly used rating tool in the clinical trials investigating Parkinson's disease, and it evaluates many aspects of the condition of the patient. The hypothesis is that Mucuna pruriens is non-inferior to the first choice treatment in Parkinson's disease, and the clinical implication at the moment is making Parkinson's treatment worldwide, globally accessible. So we are planning to submit our first paper in March and the second one in May. And so far are we now. And the quote I would like to tell you today is, if love makes the human world go round, then intracellular calcium makes the same for cells. Thank you for your attention.
Thank you for a great presentation. Sorry in advance for the late question, but regarding your first project, how can I imagine the usage of these adaptogens? Can these be some kind of a stress relief in a pill, or do I have to take these for a prolonged period?
Thank you for your question. The trials we are studying now, in those studies there are different therapeutic. So how long the interventional therapy is taken? It's different in the different trials and for the different treatments. Or adaptogens. For rhodiola rosa, it can be acute or 28 days, and for others, 30 days, 60 days, and there is also one trial with 90 days treatment. Thank you for your question.
Can I ask you about your first project? Is that you want to measure actually stress level in saliva and in serum? No, I mean, they may not be actually put together because salivary glands in some ways actually accumulate cortisol.
Yes.
I mean, the mechanism is not absolutely clear, but probably this is a case when actually the saliva is more kind of sensitive measure for stress than the blood. Am I right?
Actually, I cannot answer this question, which one is more sensitive.
I'm just saying that maybe you need to separately...
Yes, that's for sure. Yes, that's it. That is actually what I wanted to say, that first we thought that we can handle them together, but it's not the case. Yes, we have to handle them separately. Thank you.
Thank you so much for a great presentation. My question is your first project and in your background. So you mentioned for stress management. So I'm just wondering, you as a pharmacist, so there are a lot of medicine like benzodiazepine and SSRI and some beta-blocker. It can help for stress management. So what do you think? How you want to compete with these kind of Western medicine?
Mm-hmm. Thank you for your question. I don't think we can call taking benzodiazepines stress management. So it's actually treatment for anxiety. For using it just for relieving stress is actually not good practice, I would say. And we also implicate to provide pharmaceutical treatment with a rebalancing effect. That is what benzodiazepines for sure not have.
You are right about benzodiazepine. You are right, but how about the SSRI?
The same story actually.
So
yes.
Citalopram or this kind of medicine it's used for stress these days.
Again, SSRI to take them, it's not stress management. It's already treating depression. And again, it also has its disadvantages, characteristic side effects. So those are necessary in depression, but not just for stress management.
So the thing is, in this kind of lifestyle, like, you know, you are a pharmacist, but if somebody go to doctor and basically, you know, want to try to get away from the pain or stress, and, you know, for something like adaptogens, you think like, it would be in the trial, or it's going to basically get the right-away effect, or is it basically you are not sure? So because even if I have anxiety, or even sometimes for stress management, like something like alprazolam, it can help, or for something like long-term.
Yes, I understand your question. So actually, these are also described, adaptogens are also described as stress vaccines. So they prepare the body for the stressful situation, and then the body and the person can better cope with stress and with the challenges. Oh, sorry, what? So that is. There was another part. I know what I wanted to say. So actually. Yes, they have good adverse event characteristics, good side effect characteristics, so much better than all the other medicines you would think of when you talk about stress or the serious consequences of stress, yes.
Thank you so much.
You're welcome. Thank you for your question.